So, good morning and welcome everybody. I'm Mr. Khalid, you know me, and today we will just go over and remind you with the subcutaneous injection. Um, First of all, as we know, always before, after contacting with the patient, with the medications, with the vial, preparing anything, hand rubbing and hand washing is essential. Step that is critical in all procedures. So whatever you are doing the procedure, you need to hand rub and clean your hand properly. Then first thing is that we are going to check and make sure that the order is valid. And as we know, and it is not something that we need to go over, but temperature of the medication that you always have to maintain. So starting with checking on the order. So it is Mr. Muhammad Saif Hamid. His ID is 46225. He has to have a heparin injection 5,000 international unit 1 by 1 daily for 7 days starting from today. So the order is valid, and the order is to have this 5,000 international unit subcutaneous, and the order is starting from today. So we need to first go and check with the patient to make sure that he is the right patient, and to make sure that the patient is eligible to have this injection. So good morning, Mr. Muhammad. Can I check your ID, please? Okay. Can you tell me your name? So Mr. Muhammad Saif Hamid, your ID is 46225, so the right patient. And sometimes you can find the ID also is placed behind the bed. If there is a companion, you can ask, and this is the three-way verification of the ID. So he is the right patient. I am Mr. Khalid. I will be the nurse assigned to you for this day, and I'm telling you that there is an injection you have to have it, heparin injection, that is anticoagulant that will prevent the coagulation and prevent the clotting that is caused by your bedridden and the chemical that you are going to have. But before, let me ask you something, Mr. Muhammad. Have you had any episodes of bleeding from the mouth, gum, nose, anus, or through the urine? Okay, no, so it is perfect. Because this injection could possibly increase the risk of bleeding. So if you have any episodes of that bleeding, please tell us to adjust and modify the dose. But before we start the injection, please let me know that where is the last site to have this injection. Did you have it yesterday? So you don't have, you didn't, yes. But the day before you got it in here, so okay, we will choose this hand to give it today to ease the pain. But let me see first if you have any bruises, ecchymosis, scars, or any. Yes, it is clear. There is no bruises, no scars, no hematoma, so we can give the injection in this site. Now we are preparing the medication itself. Because we touched the patient, so we need to hand rub again. We need to apply the privacy, but for the sake of the video, we will not close the curtains, but you know, it is an essential thing that we all need to do. So, Mr. Mahmoud Saif Hamid, 46225, he has to have a heparin. This is the heparin. It is concentration is 25,000 diluted in 5 ml. So doing the calculation, 5,000 international unit equals to 1 ml. We need to see the open date, since this is a vial and multi-use. So the open date is 2 days ago. So it is valid because this can be open for 29 days. According to some medications, only 5 or 7 days, but this can be like 30 days and then discarded. So we can take the desired dose from this ampule. We need first to clean this ampule because it is multi-use, and we need to make sure that there is no germs. I will clean from the inside to outer side, so I will take the germs from inside and keep it out. In case of that there is any infection, I will just take it out. Then we need to aspirate, so Knowing that I'm giving a subcutaneous injection, I need to have a small length of the needle, large gauge actually, which is decreasing the length because I'm targeting the subcutaneous tissues. So if I choose a longer one, I'm hitting the muscular, so it will not do its purpose. My equipment will be the cotton ball. I need a alcohol swab. I need the syringe and extra needle. I need a plaster, first aid in case if there was some bleeding, and a gloves. So preparing the injection, I do clean the medication. I did check the temp which is also again, we will not go through it. It is something that all you know. And I am taking 1 ml, so I can do the brush-up technique. So I aspirate 1 ml and then just stick it in the medication in the vial. So I'm having 1 ml as it is the desired dose. I will not cap in any time with my 2 hands, only 1 hand pre-capping technique. I will ask my senior nurse colleague to verify the order with me. So this patient, Muhammad Saif Hamid, 46225, he has having heparin 5000 international unit, and this is the heparin via 25,000 international unit. It is opened 2 days ago and it is expiry date is May 22, 2022, and the desired dose is 5,000 international unit, which is equal to 1 ml, and this is 1 ml of the 25,000 international unit, so it is 5,000.
It's the right drug, right dose, yes.
Thank you. So we verify that it is the right drug and right dose. So now we need to change the needle to a smaller one to be appropriate for the subcutaneous injection. So we are changing the needle and make sure that there is no any bubble in it. Now I need to prepare the patient for the injection. I'm a little bit tall person, so it will be hurting my back to lean forward like this, so I can adjust the bed level and just elevate it later. But we know that once we finish the procedure, we need to return back the bed at the same level it was in order not to increase the risk for falling down or injury. So now the level is acceptable to me and easy to manipulate. Now I need to adjust the patient level, so I need to give in his upper arm, so I will expose only his upper arm. This is the area that I'm going to give him, so I need to lower down the side rail. It will be easier for myself. And remember guys, I will not touch the curtain, I will not touch the side rails with my gloves hand. Now I need to rub my hand again because I touched the patient and patient surrounding. I will rub my hand correctly and then put on my gloves and do the procedure. The pre-assessment for the heparin, as we said, patient pre-assessment, we assess that if there was any bleeding from the mouth gum, anus, anal, there is no bleeding. We assess the site of injection, it is clean, there is no bruising, no hematoma. And the last assessment is the lab results and patient significant data. According to the injection that we are going to give, it is heparin anticoagulant, so we need to go over the anticoagulant profile such as BT, BTTINR, and we need to check also platelet, although it is not related to coagulation, but it is antiplatelet, and in case of there is bleeding and the platelet is low, the bleeding will be exaggerated, so it is must be assessed. Everything is okay and this patient is eligible for this injection and he can have it. So now we are doing the gloves, we maintain the privacy, we check the patient ID, we check the patient side and lab level, lab data for eligibility of the injection, double check with my senior nurse and prepare my dose. Always make sure that you have checked the temperature of the medication. We know that the subcutaneous will be in at least three different sides. One of them which we are going to give is the upper arm, and we can locate it from the acromion process 3 finger, the elbow 3 finger. So the area in the middle lateral. So it will be middle lateral area in here. 3 fingers, 3 fingers. This is the area to give. The second area to give is the abdomen, and we can take the umbilicus as a landmark. From the umbilicus, you can put 2 fingers, so this will be the area to give, or here, and it will be that area to give in here. I will not give in this area, I will not give in this area. Only 2 fingers to the right, 2 fingers to the left. The last area to give is the thigh, and I will choose the area by locating great trochanter and the knee, and the area to give the subcutaneous will be in the middle lateral, the same as for the upper arm. Middle lateral, and the umbilicus. So we will have a landmarks. In the upper arm, our landmark is the acromion process, elbow. In the abdomen, our landmark is the umbilicus. In the thigh, our landmark is the great trochanter and the knee. So we decided to give in the upper arm. We prepared our medication. So I will keep the cotton ball with myself to make sure that I will put it after I finish the subcutaneous. For subcutaneous injection, I will go with a 45 degree. I need to pinch the skin. So according to the landmarks, this is the area where I need to give. I will clean from inside, outside. Then I will prepare the injection. I will pinch the skin with a 45 degree, and then I will give my injection. Well, place the cotton, keep the needle away, make sure there is no bleeding. Yes, there is no bleeding. I will not rub it, I will discard immediately. I will just put on first aid plaster, because most of the patients will ask for it, and it will make sure that there is no bleeding. Mr. Muhammad, I just gave you the injection. Please let us know that if you have any bleeding. As you know, this is anticoagulant injection, so there is a risk for bleeding. So if you have noticed any bleeding from mouth, gum, anus, urine, let us know. It is best to use soft toothbrush, not use sharp things. Try not to injure yourself because the bleeding will be exaggerated. Then I will just take off my gloves. I will do the hand rub again. I will return back the bed to the lowest level. Make sure that you maintain safety. Elevate the side rail. Lower the bed. And keep the call bell near to the patient. Mr. Muhammad, this is the call bell. If you need something, if you feel something is inappropriate or wrong, or you have bleeding, just call us by pressing the call bell. Now we are going to document that we already gave the patient the correct dose, the correct medication at the certain time, at the correct time, and the patient is having his teaching, having no side effects, and there was no any contraindication for giving that injection. Then I need to sign my name and sign it on the system in order to verify the medication has been given. Finally, I will clean everything according to the hospital policy, and that will be all. Thank you.